Okay, here we go. This is the topic that I would like to present to you today, related to the Tripartite work program on antimicrobial resistance. Now, I hope you got a strong sense during the introduction this morning, the opening session, of the very strong collaboration that the OIE, the WHO, and the FAO have produced over many years. Now, each of our respective organisations has been focused on antimicrobial resistance for many years and developed strong frameworks, strong standards, and expansive work programs on this topic. But in fact, in 2010, when the One Health movement was gathering steam, and we came to understand that the One Health approach must be a practical approach. It can't be theoretical. And three particular priority topics were chosen: rabies, zoonotic influenza, and of course, antimicrobial resistance. And the Tripartite produced the One Health concept note and began working collectively on a collaborative work program on AMR since that time. Now, last year in 2017, recognising that our collaboration under One Health had expanded greatly and in fact had come to encompass many other horizontal elements such as health services strengthening, R&D prioritisation, and of course emergency management. We expanded and strengthened the collaboration and introduced the new strategic concept note in 2017. In the intervening period, of course, in 2016, the United Nations General Assembly had welcomed the three Director Generals from the Tripartite and introduced the topic of AMR and established the Interagency Coordination Group, which Professor Dame Sally Davis will talk to you immediately after my presentation. The three Director Generals of the Tripartite met during the context of an IACG meeting in June this year and signed a formal MOU which has directed our organisations to develop and document this draft work program that I will introduce to you today. Of course, the three organisations have their respective work programs. The WHO's Global Action Plan was also ratified by both the World Assemblies of the OIE and the FAO, and OIE and FAO respectively introduced their action plans for the FAO and their strategy for the OIE, which has resulted in a comprehensive program of activity under these three documents, but it has also created a strong sense of cohesion because each of these documents is strongly related to each other. So for our membership, for the World Assemblies that have endorsed these activities, it provides a strong sense of a cohesive work program. And that work program is a One Health work program. Our activities in AMR and our growing understanding of the breadth of usage of antimicrobials across human health, animal health, plant health, and also through the food chain in terms of food production and in food safety. But also our growing recognition of the environmental exposures that many of these usages, or in fact indeed the manufacture of antimicrobials, but also their usage in different systems, from human health, where residues may appear in metropolitan sewage schemes, through to animal health, where runoff from effluent can create residues in the environment, and also, of course, in aquaculture, where the use of antimicrobials in feed for aquaculture creates a strong pathway of exposure of the environment. Now, it's the recognition of the breadth of actors in these regulatory frameworks and their role in terms of driving prudent use of antimicrobials that has led to some of the messages in the various communications products, such as the ones that you'll see on the screen now. Now, when we recognise how broad this issue touches, and we have come through the work of the Interagency Coordination Group to appreciate the breadth of agencies that should be playing a role in AMR, we've looked across the United Nations agencies and work that Dame Sally has led herself within the IACG with the support of Wellcome Trust, identifying the international agencies that should be playing a role in AMR. And also we've looked across the broader community of interest and identified a very broad stakeholder community that needs to be engaged in this topic if we are to meet the challenge successfully. Now, I hope everyone in this room can see themselves represented in this map, because it indicates that it's not just the international organisations and our members, the national governments, but it includes the industries, civil society, the research community, and all the various specialist professions and actors that go into, that play a role in these various supply chains. One in particular, you've already heard this morning, an international organisation that the Tripartite is now working very closely with, is the United Nations Environment Programme, or as it calls itself, UNEP. UNEP received a strong mandate from its own World Assembly to engage on AMR. In their 2017 Frontiers report, they have explored this issue and its impact in the environment and the role that environment regulators may play. This has driven the Tripartite to work very closely with the UNEP. UNEP is now engaged with our activities in what we call the Tripartite Plus. Now, I think Dr. Tekala this morning noted that FAO hosted a meeting it was in September, just a month ago, 2 months ago, in Rome, where the Tripartite Plus, so that's WHO, OIE, FAO, including UNEP, came together for a 3-day workshop focused on developing this collaborative work program. This work program that I'm going to present to you focuses on our collaborative activities, the activities that we want to drive over the next 2 years. Now, over the course of this conference, you're going to hear a lot about the respective agency work programs. My colleagues from OIE are going to introduce you to the work of our standard setting, the work of what we call our PVS pathway and its legislation support program, the work that we're doing in terms of antimicrobial usage and the accounting systems for AMU, as we call it, and our communications activities. You'll also hear from our FAO and WHO colleagues about their respective institutional work programs. But what I'm presenting to you today is the collaborative effort that over the next 2 years the Tripartite Plus intends to drive. And it focuses on these 5 areas which are very closely aligned to the Global Action Plan. So let's start in focus area 1, which focuses on awareness and behavioural change. Now, collectively, the Tripartite has developed a broad range of communications collateral or communications products. And you'll see some of these examples on the bottom of the screen. In particular, the focus on World Antibiotic Awareness Week has given us the opportunity to collaborate on a broad range of communications campaigns, making products available to our members for co-branding, for translation into local languages, and uptake for public consumption. What we want to achieve over the next 2 years, and I'm not going to spend too much time on this because this afternoon you'll get a specific presentation on these activities and we'll have a session focused on the topics of behavioural change. But we want to create an open source repository for all these products so that all our members and the broader stakeholder community can access all of these products, use them in your own campaigns. We want to undertake a series of regional workshops to really discover what works, what resonates at the ground level in different regions, and recognising that because of a variety of geographic, regional and cultural differences, what works in one region may not be immediately transportable to another. We need to take an analytical approach to this issue. This subject of communication and behavioural change has its own set of expertise that we need to draw on from the experts in this topic to understand exactly how to reach our target audience in the best way that we can. And we need to ensure that the focus here includes low and middle income countries, the countries that perhaps are hardest to reach and are having the greatest difficulties in terms of implementation of their national action plans. So, in this afternoon session, you'll hear a lot more about this topic, but it is a very important one. Now, focus area 2 is surveillance and monitoring for both antimicrobial resistance but also antimicrobial usage. Again, a significant technical challenge. I think we all recognise that what gets measured gets managed. That's a very important paradigm when we think about global programs. Across the bottom of the screen, you'll see a number of the activities that have been initiated already. On the bottom right corner, you'll see the coverage of countries that has been achieved through the WHO GLASS program, an international program that is drawing together on a voluntary basis countries into this program to report on their usage of antimicrobials, their detection of resistance across One Health. There is a strong focus on human health here, but it is also inclusive of the food chain and inclusive of the animal and other sectors. The OIE's efforts over the last few years have been focused on accounting for antimicrobial usage. And my colleague, Dr. Delphi Gonzalez, tomorrow will give you an insight into the third annual report that the OIE has produced, surveying our members on your antimicrobial usage. What you see at the bottom of the screen are some of the insights from last year's report, which has enabled us to gain an insight on the numbers of countries that provide a regulatory framework that allows for use of antimicrobials as growth promotion, that identifies which molecule classes are being used for growth promotion, and also that identifies overall the total usage of antimicrobials in the animal sector. What we're intending to do together as a tripartite is to bring harmonised guidance, harmonised One Health guidance to this matter. We need to look at the feasibility of systems that monitor agricultural production as an alternative means of achieving an understanding of global consumption. At this stage, our members are encouraged to look broadly across a variety of means of data sources to understand their country's consumption. But we haven't yet tapped into the possibility of working strongly with the pharmaceutical industry, the manufacturers, to understand whether we can get a handle on consumption through that means. We need to pull together our national data on resistance and consumption and make it broadly available to all the actors in this community of interest. Our intention is to create a tripartite integrated surveillance system platform where all the data will be brought together from the various sources and presented in an integrated way for the academic community, the research community, for monitoring and evaluation purposes. Of course, we'll be encouraging countries as well to make their own data available on national websites. The third focus area is on fostering research and development, access and stewardship. Now, on the bottom left of the screen, you'll see the report that World Health Organization has been leading, together with OIE and FAO, of course, on the global framework for the development and stewardship to combat antimicrobial resistance. Now, the scope of this activity is exactly the scope of this focus area. We want to expand the expert group that has been AGISAR to become a truly One Health focus. We're calling it T plus AGISAR, a group of experts that will guide the Tripartite Plus agencies as we look at what are the important means of creating a stewardship framework that drives responsible use, but also in those countries that require it, creates the regulatory environment to provide access to antimicrobials, recognising that in different countries around the world, these issues are related, but access may be more of a focus for some countries. Within this framework as well, both WHO and OIE produce their respective lists. For the OIE, it's simply called the OIE list of antimicrobials of veterinary importance. For the WHO, we have the CIA list, the critically important antimicrobials list, and the respective usage frameworks or recommendations that go with both of these lists, recognising the relationship and the way that the OIE is ensuring that for those highest priority critically important antimicrobials for human medicine, we have the strongest usage recommendations relating to ensuring that they are not used for growth promotion purposes and ensuring that they're not used as a first-line treatment in animals. New in this space, we want to create an e-learning platform that will serve the community of interest across all the One Health paradigm, collaborative effort from the Tripartite to put learning materials in the hands of our members and the broader stakeholder community. Focus Area 4. We've already heard this morning the significant challenge. We're going to hear more from the political panel immediately after lunch, the challenges that our members are having developing, but primarily implementing their national action plans. The Tripartite has collectively worked on a number of tools to support the development and implementation of national action plans. The toolbox you'll see in the bottom left, the survey that has now in its third annual iteration, which on the development and implementation of national action plans amongst our members. And this data is freely available on the World Health Organization website. And I invite you to explore it because it really provides a very rich understanding of where the international community is at with this challenge. I'd also like to recognise the tools that have been created by the many partners in this space. And you'll see on the bottom right the toolbox that REACT has created, which is also drawing together and compiling an extraordinary amount of helpful guidance and information that members can draw on. And of course, related to the importance of legal frameworks for AMR, the FAO's FAO Lex database, their legislation database, is another rich resource that we can all draw on to understand where our members are at and to drive best practice in terms of legislation. But countries need support in terms of implementation through these tools, but also direct support. Support in understanding the economic benefits associated with rising to the AMR challenge, the potential economic impact associated with AMR. All of this will be provided through the activities that are described under the focus area 4. And the fifth focus area relates to monitoring and evaluation. Now, you'll see the way that the tripartite is thinking of linking the inputs and their associated activities to outputs, to outcomes, to the goals that we need to establish. The big challenge here with a monitoring and evaluation framework for AMR is gaining the connection from the national to the regional to the international, so that we see a natural flow of the information and the data that we need to collect from national action plans, that we see national action plans that describe the range of data to be collected at a national level. Regions are supporting each other and collating this information and presenting it on a regional basis. And then this is linking up to the international effort on monitoring and evaluation. And our intention is to use these frameworks to produce an ongoing series of global reports that demonstrate the progress that we're making and our performance in rising to this global challenge. So, in conclusion, the tripartite One Health collaboration and its commitment is stronger than ever on this global topic. The tripartite and its partners, including UNEP, and working very closely with the IACG, feels a strong sense of leadership on this challenge. And we know that leadership on a global challenge requires a strong sense of coordination, because although our members give us their mandate, support us in our work programs and support us in our standard setting role, it's our members themselves that have the sovereign authority to drive activities in your countries, which is exactly what is required. New partnerships are forming. As we've indicated, we need to expand this community of interest, draw in the partners, make them feel welcome, achieve that sense of role clarity and coordination that a global program needs. Each of our tripartite institutions will maintain its own work programs, as well as this collaborative work program that leverages the One Health dimension of AMR. Now, of course, our collaborative work program requires support. It requires funding support, and we're working together on the resource mobilisation challenge as well. But we're seeking funding partners. We appreciate the funding support that we get from many of our funding partners. But this work program, it's an ambitious one. We have a costing that goes with it, and it does indeed require funding support over and above what the agencies receive from their statutory contributions from their members. Of course, the tripartite is working very strongly with the Interagency Coordination Group. The report back to the United Nations in September 2019 that Dame Sally will tell you the pathway that we're on in that respect will create a very important moment, and we need to be ready to seize that opportunity, to seize the opportunity that the political mandate from the United Nations General Assembly's report next year we expect to provide to the Tripartite Plus to deliver the work program that I've presented you today. Thank you.